over the past 2 years, we've undergone an enormous effort to revise our treatment model and really seek to standardize the way services are delivered in all of our regions. Staffing is a challenge, and it's not just from a hiring and recruitment standpoint, but we really wanted to put resources into retention, right? So we were looking for a more objective measurement tool, and we thankfully stumbled upon Eleos, who has essentially helped us with all of those needs to a significant degree. So Eleos has, from a documentation standard, provided suggestions in terms of capturing the progress over time. But I would say from a documentation standpoint, the biggest immediate benefit is twofold. So a lot of clinicians, when they're doing a service or a session, they'll have kind of the legal pad or like sticky notes off to the side just to jot down what they believe are key moments or important pieces of the session, so that when they go back and they do the note, that they're not going to forget that. Eleos removes that need for you. The other piece is it really does allow for the clinician to be fully present. So I no longer have to worry if a client says something that's critical. Eleos has provided us the opportunity to review evidence-based interventions that are used during the session, the overall frequency, and also gives us the capacity to measure the efficacy, right? So it allows us to look at the evidence-based techniques that the clinician's doing, how it's impacting the session, but it really has allowed us to focus on work-life balance, the quality of a professional life, right? As a clinician, if I feel as though I'm impacting positively an individual's life, or I'm doing something that's meaningful, that's going to make me feel better about coming to work every day. In my experience, there's that desire to do direct observation when you're rendering clinical supervision, but that becomes a challenge, right? But Eleos really has given us that on-demand access or ability to provide direct supervision. The other aspect is we've seen clinicians actually bring that into the session with the client. So as a part of the session, kind of using that to reference, are we working towards our treatment goals? How is that session? Like in our last session or our last 2 sessions, these are a lot of the key words that you mentioned. What do you think that's about? Even giving the client an opportunity to look at it from a different lens. A client who's resistant, which from a drug and alcohol standpoint, it is a fair amount of them. Me as a counselor, right? At first, they're going to be skeptical of my opinion. If we're able to bring in an objective measurement tool, it can validate what it is that I'm saying and really break down some of that resistance, because now it doesn't have to be me against the client anymore. We were looking at approximately 10 minutes for an individual note, and we've gotten that down to 3.2 minutes, which is amazing. I mean, that's incredible progress. And then the time for submission, that when we've presented that that metric, people do not believe us. They really do not. This is another one that this is a comment quote from our president and CEO. What we've seen is an increase in evidence-based techniques, increase 35% over time for those Eleos sessions. That's a phenomenal metric.